Good afternoon, everyone. Hi, my name is Tony Gerlach, and I'm a critical care pharmacist speaking with the panel that just came from the ICU Burnout Symposium that was put on by the Critical Care Society Collaborative. And if you wouldn't mind introducing yourself and where you're from and your affiliation.
Sure, Tony. I'm Kurt Sessler. I'm at Virginia Commonwealth University. I'm a pulmonary and critical care physician. I'm also past president for American College of Chest Physicians.
Hi, I'm Ruth Kleinpel. I'm at Vanderbilt University Medical Center and also Rush University Medical Center. And I am the immediate past president of the Society of Critical Care Medicine. I'm also a practicing acute care nurse practitioner.
I'm Mark Moss. I'm an adult pulmonary critical care physician. I'm at the University of Colorado in Denver, and I am the current president of the American Thoracic Society.
Well, thank you for being here. Now, my first question is, what prompted the CCSD to actually put on this symposium on burnout in the ICU that was just done in December?
Well, at today's session, we actually were talking about the National Summit to address burnout prevention in ICU clinicians, and the Critical Care Societies Collaborative hosted that, really in response, I think, to the ongoing work we've been doing as a collaborative, addressing the topic of burnout in the ICU and how to prevent that. So the societies issued a call to action that was published in all 4 of the journals in July of 2016. And we continued to look at the area and identify that having a summit to bring in experts in other fields to help inform the collaborative would be very useful.
No, I think it was very useful coming from as a clinician standpoint. And taking away from it, what do you think was the major points from that summit that everyone should know?
Well, I think there's a lot of work to be done. What we were successful in doing was attracting some very bright people who were doing work in the area outside of critical care and merging them with individuals who are involved in that topic on the critical care basis. So that was a great collection of smart folks, and we tackled a lot of important topics. Some of those really addressed where we are now, but what are our opportunities, particularly research opportunities, but also practical aspects of what can the person who is addressing burnout in their ICU do today. So we're trying to tackle both ends.
I think one other thing that we did, Kurt and Ruth, is we built a community of people that are interested in the topic and will help us as the Critical Care Society Collaborative move things forward that have expertise outside of our area. They were very engaged in the process, and I know if we call on them and when we call on them again, they'll be engaged in the future.
I think that was one of the big points that I actually took away myself, is this isn't just a problem in the ICU, it's holistically everyone in the healthcare setting, and we need to get our experts out there who are maybe not ICU clinicians to help us identifying our patients, which I think was another major theme, is to how to reduce the stigma and recognize burnout in our colleagues. And do you guys have any experience with that?
Well, you know, when you look at healthcare clinicians, especially in the ICU, we're exposed to obviously a lot of stress in the ICU, and burnout has always been there, but it really was never addressed. And so I think we're seeing a lot of more focused on wellness and resilience in healthcare. The National Academy of Medicine obviously has their ongoing initiative to address resiliency, but particularly for critical care, I think that's one of the reasons the Critical Care Societies Collaborative has continued to address that, to really highlight that it's not a character weakness or a flaw. It's something that is a result really of a lot of risk factors, and the ICU certainly has a lot of risk factors for creation of burnout.
Thank you for actually publishing online the videos and the results of the study for everyone to see, open access. Would you mind, Ruth, telling me what the website is so people could go and access it?
Sure. The Critical Care Society has had a website for many years, and we have put the information from the National Summit on addressing burnout open access on the website. So the website is CC Critical Care Societies Collaborative Online. So it's ccsconline.org. And on the Burnout page, we've have the call for action that was published in the 4 critical care journals. We also have the videos of the faculty from the National Summit. There's audios of the question and discussion periods, and we have really a summary of the Burnout Summit, but we're looking to update that as we have additional resources as well.
Well, very good. Thank you very much. Now, part of the reason I was excited to interview you guys is at our institution, I've started with my colleagues actually a committee to look at burnout in all of our ICU clinicians. And although we're in the very infancy standpoint, what would you suggest to me and our viewers at home are some of the things that we should look at for burnout in our colleagues?
Well, I think part of this is to embrace that burnout is an important topic, and to make sure that individual units and organizations as a whole measure burnout and report it, and actually ideally include it as a key performance indicator of some sort for their unit or for the organization. So just as we keep track of other important metrics, this should really become one, and if we measure it, we're going to pay attention to it. So part of it, I think, is that aspect of it.
I think as new initiatives are rolled out, hospitals try to expand, build a new clinic, set up a new office area, maybe make the hospital a little bit bigger. There are metrics that they normally look at about how many patients they've seen, etc. Built into any new project should be, how does this affect job satisfaction for the people that work in that environment?
I think those are very good points, and I think that was one of the big points is taken away is that when you use the survey, and most notably I think is the Mosenbach survey for burnout, it's something you need to do continuously, and just doing a baseline is not good. We need to continuously do it on a annual or regularly scheduled basis, and as you just said, to also engage administration that this is a key metric, just like ICU acquired infections or medication safety or patient falls or whatever. It's something that needs to be part of regularly reported out data for everyone there. So,
and Tony, I think there's one important thing you just mentioned is that if we record the information and collect the information on people, it can't be that they then are perceived as being penalized for saying that, because what can happen is if someone reports out that they have symptoms of burnout and all of a sudden you're pulling them away, adding things for them to do because they have to go talk to someone about that, then they're not going to report it accurately anymore. So we have to make sure that the stigma is not there, that people feel comfortable reporting, and that the consequence of testing positive is not creating more work for them.
I think that's a very good point and stuff. Now with my next question, what are some areas of improvement, or what can an individual do to actually help with burnout themselves if they feel or realize that they have some burnout symptoms?
Yeah, there's actually a lot in the literature in terms of useful interventions, organizational interventions, as well as individual. There's really not one set for everyone, but certainly a lot of options in terms of exercise, making sure your sleeping habits are appropriate, nutrition, mindfulness-based stress reduction. A lot of places are actually having workshops in healthcare settings, yoga, those types of things to really exercise whatever you feel is best to really de-stress.
Yeah, I personally myself, a few years ago, I was going over burnout, and I like to say CrossFit kind of saved my life, because it actually helped, because I was able after work to do CrossFit, and when you're doing 50 burpees, all you want to do is do 50 burpees and get done. That allowed my mind to not ruminate on that day's problems, and it really did make a big difference and a much better outlook on my life. So I think a lot of these things are very useful for our people, and I very much want to thank the Critical Care Society's Collaborative for really addressing these issues, as evidenced by such a great turnout today and a lot of great questions. So thank you very much for coming here. And is there anything else that you guys want to enjoy in San Antonio?
Well, certainly we have the upcoming induction of the new fellows in the American College of Critical Care Medicine, and certainly the plenaries that are here, and I think just the collegial relationships and networking is always great.
Well, thank you. I look also forward to the convocation coming up of the new fellows, and thanks everyone for coming here, and have a great day.